Hi, my name's Angela, and I'll be covering hemophilia. So, hemophilia is a genetic mutation that occurs in the sex chromosomes. To be more specific, it is X-linked recessive. And as a result, it's more common to see hemophilia in men than women. For women to have this disease, she must be homozygous recessive. If a woman is heterozygous for hemophilia, then she is only a carrier of disease. As previously stated, men are more likely to have the disease, especially if they're born from a family with a history of hemophilia. According to the American Journal of Managed Care, it was reported that there are about 1.125 million men with hemophilia worldwide in 2019. However, in 2020, it's been reported that the number may actually be tripled. When looking at the US alone, the CDC reported about 33,000 men between 2012 to 2018 to have hemophilia. However, the data isn't accurate because it only counts patients who have been in hemophilia treatment facilities. This makes the true number of affected people unknown. Moving on to anatomy, hemophilia can affect any part of the body because it's a blood disorder. However, those with a severe form are more likely to experience complications such as internal bleeding. Internal bleeding can cause severe nerve damage in muscles and destroyed joints, such as knees, elbows, and ankles. It is also possible for bleeding to occur in the neck or throat, which can also obstruct breathing. Physiology and symptoms. Hemophilia is a chronic condition caused by the lack or defect in clotting factors that allows blood to coagulate and stop bleeds. There are three kinds of hemophilias that are distinguished based on which clotting factor they're missing. Hemophilia A lacks clotting factor 8, while B lacks clotting factor 4, and C lacks clotting factor 11. The severity of the disease is also important and is identified as being either mild, moderate, or severe. There are many signs and symptoms associated with the disease, including bruising, bleeding in the joints, mouth and gums, urine or stool, or unusual bleeding after injections, and frequent or hard to stop nosebleeds. If left untreated, long-term effects can include chronic joint disease and pain, seizures and paralysis if bleeding occurs in the brain, and even death. The mortality rate of men with the disease depends on the severity and treatment they're receiving. Those who receive proper treatment typically live 10 years less compared to healthy men. Diagnosis and treatments. Hemophilia is typically diagnosed at a young age. In 2/3 of the case, the disease stems from a family with a history of hemophilia. Families with a history of hemophilia typically take tests determining the child's chance of developing hemophilia themselves. The other third is tested when an unusual bleeding event occurs, as there is no known family history of hemophilia. Severity also plays a role in diagnosis. The more severe and prevalent the disease is, the sooner the child is tested for any blood disorders. Hemophilia treatment centers are available to assist and educate those affected by the disease. Hemophilia is treated by replacing the missing blood clotting factor through blood infusion. The main types of clotting factors include plasma-derived clotting factors and recombinant factor concentrates. Plasma-derived clotting factors come from multiple people who have donated their plasma, while recombinant factor concentrates come from genetic engineering. For side effects, unfortunately, the development of antibodies against the clotting factor is possible, which makes the condition more difficult to treat. Finally, when it comes to AI, a framework called HemoClass has been created to determine the severity of hemophilia in patients with specifically with hemophilia A. It does so by looking at the gene information and protein structure properties for the factor 8 protein. Thank you.